All right. We are live. All right. Hello, everyone. Welcome to our first Instagram Live event of Endometriosis Awareness Month. My name is Laura, and I'm going to give everybody a couple minutes, and then I'll further introduce myself and get started. Today we're going to talk about endo and bladder pain. Big problem, but we've got some solutions that we can talk through. All right. Lots of people logging on. That's great. Awesome. All right. Give everybody a couple minutes. I'm going to get myself situated a little bit better. There we go. Okay, good. So like I said, my name is Laura, Laura Brott. I am a nurse practitioner in our Falls Church, Virginia office. So we're like 30 minutes outside of DC. It is Endometriosis Awareness Month, and we at Pelvic Rehab Medicine are putting on a lot of events this month, this being just the first of many. Want to point out later this week, there is the Endometriosis Summit down in Orlando. A lot of our providers are going to be presenting at that, and we're going to have a lot of those live streamed on Instagram. So feel free to drop in and listen to those. They'll be super great, super educational, lots we can all learn from them. Our providers have so much knowledge, the ones that are presenting there, and really excited to hear what they have to say. Okay, so like I said, today I'm going to be talking about endometriosis and bladder pain. I'm going to talk through kind of the reasons that people with endo can have bladder pain or urinary issues at all. But then also we are going to talk about the different ways that we can address it through medical things, but also through some non-medical things like lifestyle changes. And then at the end, if anybody has questions, feel free to ask. We'll have like a little Q&A session at the end. If there's any question that I don't feel comfortable answering, or if you don't feel comfortable asking something on such a public forum, feel free to send us a direct message. Oh my goodness, hi from Portugal. Wow. That's awesome. Okay, anyways, like I said, feel free to send us a direct message, and we will get it all figured out. And like I was saying, if there's anything that I feel like I'm not totally sure how to answer, or I don't feel confident in my answer, we'll do a little bit of background research. I'll do a little thinking, a little brainstorming, and hopefully we can put together another little video for you, or a blog post, or something like that. So this is not the end-all be-all of talking about bladder pain. All right, but anyways, we'll just jump into it. So endo can cause bladder pain in lots of different ways. But first, let's talk a little bit about what endometriosis is. The common misconception is that endometriosis is the cells that line the inside of the uterus growing outside the uterus. That's not exactly right. It's what everybody thinks, but that's not really how it is. Endometriosis is more cells that are similar to the inside of the uterus, but they're just really inflammatory. They're not exactly endometrial cells, but they're really inflammatory, meaning they get red hot, angry at different areas of the body. Endometriosis can be present all throughout the body, not just in the pelvic or abdominal cavity. It's been found on almost every organ in the body, possibly every organ in the body. I'd have to fact check that one. But the most common places that it's found are in the abdomen and the pelvis. It can be found directly on the bladder. That could definitely cause bladder pain. If you have an inflammatory lesion on your bladder, it's probably not going to feel very good. So that's one reason that people with endo can have bladder pain. Another reason is that the pelvis is a pretty unique part of the body, and that it all kind of talks to each other. All the different organs, all the different areas. So if there's inflammation somewhere in the pelvis, then it's probably going to lead to inflammation elsewhere. If you have an endometrioma, which is an ovarian cyst made of these endometriosis cells, that was the dumbed down way of describing it, but anyways, if you have one of those, it can cause local inflammation elsewhere. Inflammation from endometriosis puts out these chemicals that just say, hey, everything else in the pelvis, I want you to all be angry all at the same time. And so that can, like I said, lead to bladder inflammation or bladder spasms. It can also lead to my next reason that you can have bladder pain, which is muscular dysfunction. So one of the things we focus on a lot at PRM are the pelvic floor muscles. And the pelvic floor muscles are really sensitive to any sort of inflammation in the pelvis and the abdomen. The pelvic floor muscles are super protective of us and super protective of our wonderful little organs. But sometimes that backfires. And so the increased tone of those pelvic floor muscles can cause some bladder symptoms, bladder pain, and also a lot of the symptoms of a UTI without actually having a UTI. People with endometriosis, I'm sure, know this very well. It's that classic, you have urgency, frequency, that burning when you're peeing, and then you go to the doctor and they say, no, everything's fine. You don't have a UTI. And you're like, well, what's going on? Why do I feel like this? A lot of it is just inflammation from the bladder, the pelvic floor muscles, all of it. It's squeezing muscles, squeezing nerves. I don't really like it. Yeah. So it doesn't feel good. So what we have to do is calm everything down. So lots of different ways you can approach that. Now, I would like to say that if you're having these sorts of symptoms, urgency, frequency, burning with urination, pain with bladder filling, bladder pressure, it's always good to get evaluated for an infection. You want to either go to your primary care or your gynecologist, or if you have a urologist, that's great, or a urogynecologist, because just because you have endometriosis doesn't mean you can't get a UTI. It just means that often people feel like they do and they don't actually have one. So important to get evaluated for a UTI so that if it's necessary, you can get antibiotics. But we don't want to just give out antibiotics willy-nilly because that causes other issues. All right. So like I said, get that out of the way. Make sure you don't actually have an infection. Urology and urogyn are really important to also have on board to make sure that there's no anatomical issue inside the bladder or in the urethra or the ureters or the kidneys or anything like that. But once all those things have been ruled out and you know there's not an infectious cause, there's not an anatomic abnormality, then you can proceed with managing this pain in all the ways that we're going to talk about. So first thing is some lifestyle modifications. Now, none of these recommendations are going to be blanket recommendations for everybody. Everybody's body is a little bit different and everybody responds differently to everything. And so, you might have a friend who has bladder pain and they say, well, anytime I drink coffee, it makes it a lot worse. That doesn't mean that you can't drink coffee. It just means you need to pay attention to your body and just see what triggers you and what doesn't trigger you. But a lot of common foods and drinks that can increase bladder pain are anything that's super acidic. So lots of citrus foods, oranges, tomatoes, that kind of thing. Caffeine, so coffee, tea, chocolate sometimes can even do it for people. And then any really processed foods, especially processed sugars, saturated fats, and alcohol. All of those things are inflammatory in the body and can cause any of these symptoms to kind of flare up. Those really should be avoided in everybody, though. It's not just people with bladder pain, everything in moderation. But like I said, everybody's body is different. And so these are not blanket recommendations. They are just suggestions and ways that you can think about the foods that you eat as like figuring out what your triggers are. So paying attention to diet, wanting to, focus on a well-balanced diet and just trying to find your trigger foods. The other thing is hydration. Now, this doesn't mean you need to drink 8,000 liters of water a day. Really, it's just important to make sure that your urine is like a light yellow lemonade color all day. For some people, their pain feels like this burning pressure sensation with bladder filling. So I don't want their bladder to be full all day. I don't want them constantly drinking water. But I also don't want them dehydrated. So again, everything is personalized. We're all different, and none of these are going to be blanket recommendations. But just focusing on keeping your urine that light yellow kind of lemonade color. And so the other lifestyle recommendation that I would recommend for bladder pain, and really for all endo pain, and I'm sure it'll be mentioned in many, many of our events this month, is just general stress reduction. Our bodies are really, really receptive to stress. And when our brains are really hyped up and really anxious, it causes all of our nerves and our muscles to kind of do this, and that's not going to lead to more comfortable urinary symptoms. It's not going to lead to your bladder feeling great. So just trying to focus on mindfulness, maybe doing a little bit of meditation if you can fit that into your schedule, practicing your diaphragmatic breathing, your deep breathing, all of that kind of stuff, just to really calm everything down. Every single person I know, myself included, is working on this every hour of the day, every minute of the day. Nobody is perfect at this. We're all a work in progress, but just continuing to work on it can always be helpful. Next, I'm going to talk a little bit about some of the different oral medications that can be used for bladder pain. Now, all medications have side effects. Nobody responds the same to one medication as their friend. So please talk about these with your healthcare provider. And again, know that everything is individualized, and unfortunately not everybody responds super well to everything, but we have some tools that we can try. And maybe you can take some of these suggestions to your provider if there are things that you haven't tried yet. So one of the first line drugs that often we try for bladder pain is called amitriptyline. It is really good at just like, how do I say this? It has analgesic properties, meaning like pain relief properties to the bladder. And it can also help with some of the mood symptoms that can be common with any sort of chronic pain state. Being in pain for a long time makes most people not feel super great. So amitriptyline is one of those first line meds. The main side effects of amitriptyline are things like dry mouth and constipation. So those are things you really want to pay attention to, and if they're super bothersome to you, then, sorry, somebody asked a question. Over-the-counter medicines, yeah, I'm going to talk about those, okay? Amitriptyline, the side effects, yeah, dry mouth and constipation. So make sure you're talking to your doctor about those if they come up, because there are lots of other options too. Another medication, a prescription medication this is actually the only one that's FDA approved for something called interstitial cystitis, which is basically bladder pain. Sometimes coexists with endometriosis, sometimes on its own. But it's called Elmeron. The long name is pentosan polysulfate sodium. I had to write that one down. That one, it works well, but it doesn't work quickly. It takes 3 to 6 months for you to really start feeling any relief from that one. And there are some questionable side effects or long-term effects related to eye health. So that's one you really want to talk to your healthcare provider about. If you have any sort of optic issues, make sure to communicate those with your provider. Some other medications that we can use are ones that can also be used for anxiety. One is called hydroxyzine. What it does is it calms down something called the mast cells in the bladder. And basically, it just reduces inflammation. Hydroxyzine can cause some sleepiness, so it can be really good for people to take at night, especially if you're getting up in the bathroom, getting up in the night to go to the bathroom a lot. It can reduce the amount of times you're getting up. So that can be super helpful, because getting up to pee 3 to 4 times a night is not leading to good sleep, and sleep is restorative for your body, so it can help in many ways. Then the next ones that are prescription, that's kind of like the last options are some neuropathic pain meds, so nerve pain medications. So that would be things like Lyrica or pregabalin and gabapentin. These help calm down the peripheral nerves in the body. And the peripheral nerves are often the ones that are causing that burning sensation at the urethra when you're urinating, or if you're having any pain with wiping or anything like that. So those can be good ones for those. And Lyrica especially, I find that is pretty well tolerated by patients and can be really, really helpful. A lot of these medications can be used intermittently, not meaning like you just use it as needed, but Lyrica, you use it for 3 to 6 months, you kind of calm things down, and then hopefully you can get off of it and see how you do. But again, everything is personalized. You need to be talking to your specific healthcare provider about all of these things and how you're responding to them. Some over-the-counter meds that you can use. You can take things like ibuprofen and Tylenol if you're having, especially I feel like bladder pain, I'm going to scoot back a little bit. Like if you're having specific pain here over your bladder, sometimes those medications can help. I find they're not as effective as some of the other things on the market. If you find that acidic foods are really, really bothersome to you, that they're triggers for you, there is a medication called Preleaf, like the word relief, but with a P, Preleaf. And basically it lowers the acidic content of the foods to hopefully not cause a flare. So if you're going to a restaurant and it's, an Italian restaurant, might be something you could consider. It's helpful for some people, not for everybody. It's one that can be taken on and off as needed. The other medication that a lot of people have taken and that people know pretty well is called AZO, A-Z-O. It has a very long name that starts with a P. That's like the medical name, but over the counter it's called AZO. And what it does is it calms down the bladder. It causes your bladder to not spasm as much. That should really only be taken for maximum 48 hours. And really we only want people taking that if they have a confirmed UTI, like an actual infection shown up on a culture, because then we can really kind of tailor the treatment. You'll be taking your antibiotics and be taking the AZO just for comfort, but it's not something we want people taking just randomly all the time. That's the one that can turn your pee orange if anybody has taken it before. But really want to reserve that one for if you have a lab confirmed UTI. Some last things that can be really helpful, pelvic floor physical therapy to work on those pelvic floor muscles. As I mentioned earlier, when those pelvic floor muscles are inflamed and tight and tense, it just causes a lot of anger everywhere else in the pelvis. And so if we can work through pelvic floor physical therapy to help lengthen those muscles, help them be strong when we want them strong and be relaxed when we want them relaxed, that can be really beneficial. And it's actually been shown in research to be an extremely helpful treatment for urinary pain and bladder pain for endo patients and for other patients. So, yeah. If anybody has any other questions, that's kind of the end of my little spiel, but happy to go through and see. I'm just scrolling through to see if anybody asked anything else. All right. I don't see anything yet, but I will hang out for a few minutes and just see if anybody wants to ask anything. Trying to think if there's anything. Oh, okay. How can pelvic nerve and muscle treatments help with inflammation and spastic muscles causing bladder pain? That's a great question. So I probably should have mentioned that since it's like what we do here at Pelvic Rehab Medicine. This is what happens when you go on an Instagram live and you don't really like talking in front of people, is that your brain just like goes blank. Anyways, yeah. those pelvic floor muscles, when they're really, really tight and they're causing that spasticity in the pelvis and maybe squeezing on some nerves and causing some of that burning sensation. One of the main thing that we do here at PRM are injections into the pelvis, into the pelvic floor muscles and around the nerves of the pelvic floor, to provide space around the nerves, to lengthen those muscles, so that we can reduce the inflammation in the pelvis, create a more healing environment. And we find that people have more long-term relief with our treatments. Thanks, Britannia, you're so sweet. We find that people have more long-term relief with those sorts of treatments, rather than just taking medications. But yeah, if that's something that you feel like you're interested in, I would definitely come visit us at one of our locations. We have all our locations listed on our website. We're kind of all over the country now. But let's see, what else? I'm from Belgium. The pre-leaf, is there a different name? Let's see, I'm going to have one of my little helpers put the name of that in the chat. Yes, it does have a different, medical name. It's one that I can't pronounce, so give me 1 second. Does it help to sit on a donut to relax pelvic floor muscles? So a donut can be helpful for some people. For some people, it can end up causing more discomfort and more issues. I would say if you feel like it helps you, that's great. But ultimately, I would get an evaluation with a pelvic floor physical therapist or a pelvic pain specialist, like the ones we have at PRM, just to really make sure we're not either ignoring any problems or exacerbating any problems. I hope that answered that. Okay, great. Let's see. Okay, I'm still finding the pre-leaf name. Okay, it's called calcium glycerophosphate. I will type that for you. Calcium glycerophosphate. I don't know if it has another brand name or if it's sold in other countries, but this is the medical term, the generic name for it. I'm hopeful that it is sold in other countries, but I cannot say for sure. Let's see. Okay. So one of my coworkers is going to paste the name of that, the calcium glycerophosphate, into the chat so that hopefully you can look that up. I hope they have it in Belgium. I don't know. Okay, let's see. Any other questions? Anybody? All right. So we have, like I was saying at the beginning, we have lots of events scheduled for the rest of the month. We have one of our providers, Dr. Lashir, is going to be on tomorrow, I think around lunchtime. She's going to be talking, I believe, about managing endo pain and all the different options. Confirm that on our little calendar that we have. But otherwise, in the month, we have tons of presentations on how to build your endo care team, endo and how to work with a GI specialist, endo surgery, all that kind of stuff. So lots of questions will be answered throughout the month, but if you have more questions, feel free to post them or send us a direct message, and we will get back to you as soon as we can. All right. Anybody else? Let's see. Oh, there are lots more questions. This is what, like I said, I haven't done one of these before. I got to scroll down. Are bladder exercises a long-term lifestyle change, or can you do 6 weeks, for example, and that will indefinitely strengthen your bladder and pelvic floor? So unfortunately, that would be awesome if you could just do 6 weeks and then everything be fine. I would love to be able to train for 6 weeks for something and then never have to run again or something like that. But no, these are lifestyle changes that really need to be like lifelong changes. That does not mean you can never eat chocolate or you can never have an orange again, but it means things like deep diaphragmatic breathing. It's really good to help incorporate those into your day-to-day life so that, you know, if you're driving and you're in traffic and you notice your pelvic floor, you're just like this, that you can use the strategies that you've learned through pelvic floor PT to help relax those muscles so that you're not just constantly perpetuating that tension. So being in PT can sometimes be a short-term thing, 6 to 12 weeks. But the exercises that you learn, I recommend, you know, keeping those incorporated into your life. What is the connection to perimeno and menopause and bladder issues, if there is one? So there's definitely a connection to having these UTI type symptoms with menopause. Often that can be discussed with your gynecologist. I used to work in gynecology, so I'm happy to comment on that a little bit. Perimenopause, menopause, the main thing that's happening is that the estrogen levels in your body are getting lower. Estrogen is really good for the mucous membranes in the vagina, in the urethra, in the whole like genital area. Sorry, I talk with my hands for all of that. But so when the estrogen is lower, it causes all those tissues to be drier and they can be a lot more sensitive and you can feel a lot more of that nerve type pain. A lot of those symptoms can be helped through some hormonal medications. So like I said, make sure you're talking to your gynecologist about that. But if you have endometriosis and you're going through menopause, that can be something that you're going to need a multidisciplinary team for. But definitely something to be very vocal and open about with your healthcare providers. A lot of these things we all have been taught, like, yeah, it's just normal, it just happens, but it doesn't, and there are lots of things that we can do. So please just make sure you are discussing it with your providers. All right, let me see what else. All right. Oh, thank you, Bradania, for the name of the relief. Okay. Oh, someone said, where can we send you questions? Mine is lengthy. Oh, so if you just go to the PRM, I think their like main Instagram page, there should be a message button where you can just send us a direct message. If you want to send it straight through there, I can get back to you there. There we go. All right. Anybody else? I got a couple minutes left. These are all really good questions. I hope that this has been helpful. You know, there are, like I said, lots of prescription medications that can be taken for this, but a lot of this can be helped with some lifestyle modifications. And sometimes it's nice just to be able to identify things in your own life that you can think back and say like, oh, I really wasn't feeling good today. Well, yesterday I ate Italian food and I didn't drink any water and I only drank coffee all day. And it's nice to sometimes be able to identify some triggers like that. And the other thing that I just want to mention really quick that is if endometriosis is present on the bladder, all of these things that I've talked about can be helpful, but ultimately removing the endometriosis from the bladder may be the best thing for you. So if you have tried lots of things like this, the things that I've talked about, and you're just having persistent issues, nothing's really helping, I would definitely speak with a pelvic pain specialist or an endometriosis surgeon. The one that I work with here, her name is Dr. McHale. We have a couple throughout her locations. But I would definitely speak with somebody about excision surgery if that's where you're at. Excuse me. But like I said, we're going to have lots more events later in the month talking about that in a little more detail. Good. Okay. You talked about what foods to limit. What foods would be beneficial for the bladder? That's a really good question. So honestly, just keeping a healthy, well-balanced diet. We want good amounts of protein. We want healthy fats like, avocado, olive oil, that kind of stuff. And lots of good like fruits and vegetables and just hydrating foods. Lots of fruits, they're really hydrating. Watermelon, strawberries, those kinds of things. But I wouldn't say there are any specific foods that I feel like are like pristine for the bladder. There may be some research that I just haven't read up on, but nothing comes to mind immediately. Oh, someone said marshmallow root tea can ease irritated bladder sometimes. That is a really good one. There are lots of random herbal teas and supplements out there that can ease some of this discomfort for some people. I would just make sure to, do your research and maybe talk to your healthcare provider, because some herbs and supplements can interact with medications as well. And the other thing is that herbs and supplements aren't usually very heavily regulated. I'm not saying that I'm against those. I'm not at all. Just want to make sure that everybody is doing their due diligence when they're doing those things. Yes, exactly. Always check with your healthcare provider. Good. All right, everyone. Thank you so much for tuning in. And please, like I said, feel free to send us a direct message with any other questions, and we will be happy to get back to you. And have a great rest of your day, and tune in later in the week for more lives from us. Thank you.